Welcome back. I'm joined here with Dr. Raj Sinha of Star Orthopedics. We're going to talk about some stem cells. How you been?
I've been great. Yourself?
No complaints, my friend. Welcome back to the show.
Thank you so much for having me.
Yeah, of course. So, stem cells, what are they? For those of us who are kind of naive.
Well, stem cells get purported to be this magical panacea that's going to cure everything. What they basically are cells that have the potential to become a lot of different other types of cells. And the most basic stem cell is a brand new embryo that's formed. So when the sperm and the egg come together, that one cell that's formed has the ability to become all kinds of different cells in your body, all kinds of different tissues and organs. So that's where we first learned about stem cells. And so obviously the developing baby has plenty of stem cells, but adults have them too.
What is the usual source? Would it be the embryo?
Well, actually it turns out now we're learning that all tissues in the body pretty much have stem cells in them, even as an adult. The most common site that we first found them in was in bone marrow.
Okay.
And being an orthopedic surgeon, dealing with muscles and bones and things like that, and cartilage, there were obvious reasons why we were hoping to see the use of stem cells in orthopedic conditions. And so most of the initial work was done there. But now we're finding them in fat. We're even finding them in neural tissue like brain and nerves. So they're available everywhere, and the challenge now for scientists is to figure out how do you harness them to get them to do what you need to do to repair tissue.
Is this just the beginning as far as stem cell goes?
I think it is. I mean, stem cells have been talked about now for about 20 to 30 years, and we're just beginning to see what the potential is for them. The problem that you have with stem cells is that there's this political issue with it, and people have a gut reaction when you hear the term stem cell. That's in this country, but in other countries they're not properly regulated, and so people are doing some potentially dangerous things with them in other countries. We're not seeing that here because there is some regulation, but obviously because of that the progress is a little bit slower than you would like it to be. But despite that, we're definitely seeing I think a revolution in this whole concept of biological regenerative medicine that's occurring.
Tell me a couple of diseases that this treats, that you would apply this to.
Well, the most common thing that we do as orthopedic surgeons is we see arthritis, tendonitis, and bursitis type of conditions. So you can use stem cells that are derived from bone marrow or from fat to treat those sorts of conditions by injecting them into the site. And then the cells work with the growth factors in the local tissues to decrease the inflammation and the pain.
Okay, all right. Dr. Sinha's office is located in Rancho Mirage. You can check out Star Orthopedics' website, palmspringsKneeSurgeon.com, or give them a call. Big thanks to Dr. Raj Sinha for being here. We'll see you guys after the break.